most important, parvovirus B19. This is the only one that we are going to study. Single-stranded DNA. Remember, when viruses are single-stranded, they may be classified either positive sense or negative sense. As I told you in the last class, this is Baltimore type 2. They are sometimes positive, sometimes negative. Positive or negative. But that is not so important for you. When I explain this class about parvovirus B19, I always classify the diseases into 3 groups. Diseases in healthy people, in healthy hosts. Diseases in non-healthy hosts. And diseases in the fetus. What about diseases in healthy hosts? Most of them are children. Parvovirus B19 is a typical disease of children. It's one of the typical common diseases that we get when we go to school for the first time. Typical. Children suffer erythema infectiosum. This is a common childhood exanthem. The name is not important for you, but I explain you. Erythema means red skin, rash. Infectiosum in Latin means infectious. Typical common childhood exanthem when we go to school for the first time. So think, because I repeat this every day. When you are a baby, when you go to school for the first time, you will be sick every week or almost every week because you will become in contact with many different viruses at the same time. This is the reason why children, when they go to school, they are sick with fever almost every week. When you become parents in the next few years, your child will be sick almost every week when they go to school because they become infected by many different viruses: parvovirus B19, cytomegalovirus, Epstein-Barr, herpes simplex type 1, roseola viruses. A lot of different viruses infect children very early in life, but very mild. So this is also mild. This is very mild. I will show you later. However, sometimes adults become infected. In adults, it's also mild, but the presentation, the clinical findings are a little bit different. In adults, we can find polyarthralgia arthritis syndrome. What is this? Arthritis means inflammation of the joints. Polyarthralgia means, poly in Greek language means many. Arthralgia means joint pain. So this is the syndrome that we find in adults, but this is also very mild. So in healthy hosts, parvovirus B19 is not a problem. It's very mild. However, in non-healthy hosts, what do I mean when I say non-healthy? Non-healthy means immunocompromised people. Non-healthy means people who have anemia because of another reason. What is the problem in these people? What's the problem in these people? This is the problem. The problem is that the target host cells infected by parvovirus B19 are the human erythroid progenitor cells. These cells are found in the bone marrow. These cells produce red blood cells in the bone marrow. So when these cells are infected and destroyed, because this is a lytic acute infection, these cells are destroyed. When these cells are destroyed, the production of red blood cells by the bone marrow is stopped. Not forever. The production of these red blood cells is stopped until the infection is controlled by the immune system. So remember, the production of red blood cells by the bone marrow stops. If the infected host is healthy, nothing happens, because the production of red blood cells will be recovered after a few days. However, if the host is immunocompromised, the production of red blood cell will be stopped for a long time. So these patients will suffer anemia for a long time. In patients who have anemia already because of another reason, hemolytic anemia, but this is for next year, not for now. In these patients who have anemia because of another reason, if they are infected by parvovirus B19, they will suffer a very severe anemia. The production of red blood cells will be completely stopped. And this is called aplastic crisis. The production of blood is stopped, and this is very severe. So the problem of parvovirus B19 appears in patients immunocompromised or in patients who have anemia already. This is the problem. And the most important problem is the fetus. So look, when adults become infected, the adults may suffer almost nothing. Nothing important. The problem is if this adult is a pregnant woman. Pregnant women infected will not suffer a severe disease. The problem is that pregnant women can transmit virus transplacentally to the fetus, and the fetus will suffer a very severe disease. Many times, the fetus will die. That is the problem. Parvovirus B19 is found everywhere in the world. It's very easily transmitted from person to person through droplets. Again, transmission by droplets, very easy in school with small children, through droplets, through saliva. This is the most important source. However, unfortunately, parvovirus B19 is also transmitted transplacentally from the mother to the fetus. And the outcome is terrible if the pregnant woman, if the pregnancy time is less than 20 weeks. Terrible. Parvovirus B19 is also transmitted through the blood, parenteral transmission, but this is not common. Remember droplets, and remember transplacental transmission. So look, most people, most children, become infected very early in life. So more than 70% of adults have been already infected, and we are protected. More than 70%, but not all. So, in some countries, between 30 to 40% of pregnant women have never been infected. That means they are susceptible to infection. So, if they get infected during pregnancy, the fetus have a very high risk of becoming infected. This is the problem. So the important problem is pregnant women, immunocompromised people, and people with hemolytic diseases. These are the problems of parvovirus B19 infections. This is the structure of the virion. The nucleic acid, single-stranded, only one molecule of DNA, either positive or negative. This is the capsid. The capsid is made of small proteins, capsomers. The proteins of the capsid are called VP1 and VP2. The names of these proteins are not important. You don't need to remember. VP1 and VP2. VP2 is possibly the protein that the This is microbiology. So single-stranded DNA, capsid, and no envelope. These viruses do not have envelope. So what about the damage? What about the pathogenesis of diseases? The pathogenesis, so how damage is produced, that's the meaning of pathogenesis. The pathogenesis depends on both, as always. Depends on the virus and depends on the immune system. When we are infected by parvovirus B19, in the beginning, damage depends mostly on the virus. So we suffer non-specific symptoms like fever, headache, myalgia, maybe respiratory symptoms, so flu-like symptoms, but all of them non-specific. The erythroid cells from the bone marrow become infected and destroyed. So this is a lytic infection. These cells are destroyed. So the production of red blood cells stops, but not forever, just for a few days. So if we are healthy, we don't suffer anemia. So when the immune system starts fighting, when antibodies develop, the disease is resolved. However, later, damage also depends on the immune system, mostly on antibodies. So when the virus disappears, the rash may appear in the skin or joint pain, arthralgia. So rash and arthralgia depends on the immune system, mostly on antibodies. So this is the picture of the disease, the pathogenesis of parvovirus B19 infections. So I'm going to say very few words about this erythema infectiosum that appears in children. This is a typical disease that we show when we are children, when we are infected in school. What is erythema infectiosum? Erythema infectiosum is a mild disease, non-specific, flu-like symptoms, fever, headache, myalgia, respiratory symptoms, and a few days later, that's the meaning of exanthem, appears. In children, the typical exanthem is the slap cheek rash. This is the typical exanthem that appears after a few days, typical in the face. Some children, not all, may develop another rash some days later in the whole body. So two exanthems, two rashes. The first one in the face, the typical slap cheek rash. Second exanthem, only some children in the whole body. This is the typical first exanthem. This is the typical slap cheek rash. Typical in the face. And this one is the same. Typical slap cheek rash. Or this one. Typical slap cheek rash. This is the typical. Some children develop another one, like this one. This child has developed a rash in the whole body, but some days later. And this is very mild. Children completely recover. This is not severe. So look, in this child, we can still see the slap cheek rash, but also in the rest of the body, maculopapular rash. This is erythema infectiosum, typical of children, very small children, very mild disease if the child is healthy. The problem is pregnant women. Pregnant women transmit the disease to the fetus, mostly before 20 weeks of pregnancy, and the fetus becomes severely ill with severe anemia because the cells from the bone marrow are destroyed, with myocarditis, inflammation of the heart. The virus can infect the myocardial cells directly, and the outcome is usually very poor. Stillbirth, that means they are born dead, or abortion. So the outcome is usually very poor. So the problem is transplacental transmission from a pregnant woman with primary infection. That's the problem. We don't have any antiviral treatment. Most diseases do not require any treatment. So we only have to treat people with severe disease. We have to treat immunocompromised people. How can we treat them? We can treat them with specific antibodies against parvovirus B19, or we can treat them with, stopping the immunosuppression. For example, these patients are usually transplant patients that are receiving immunosuppressive therapy. So sometimes we have to stop the immunosuppressive therapy to wait that they recover from the parvovirus infection. So we treat immunocompromised patients. And we treat patients with hematologic diseases. I told you, these patients are the patients who can develop a plastic crisis. So these patients need blood transfusions. But we don't have any antiviral treatment against these patients. We don't have any vaccine. We don't have. But research is on development to find a vaccine against parvovirus B19 that could be useful for some people, not for all. This vaccine may be useful for people immunocompromised, for people with hemolytic disorders, for pregnant women who are susceptible, or for other groups of susceptible people that may suffer severe diseases. But currently, we don't have the vaccine yet. Research is on development. Questions before we finish?
Can you explain the word cell-mediated?
Sorry?
Can you explain the word cell-mediated?
Cell-mediated?
Yes.
So you mean the immune system, related with the immune system. Cell-mediated means mediated by cells. So when I write this word, I usually mean mediated by cellular immune response. So mediated, so produced by T cells. Cell-mediated. But where do you find that word? Can you please tell me? Because I want to check. Where? In parvovirus B19 or where?
In papillovirus, page 4 in the textbook.
Page 4 in the textbook.
Yes.
So you mean in the papilloma viruses?
Yes. In viruses textbook, in the textbook.
In the textbooks. Well, cell-mediated, when I write that word, I mean related with the cellular immune response. That's what I mean. But I want to check. Wait a moment. Here. Cell-mediated response. This one. Yes. Cell-mediated means cellular immune response. So T cells for adaptive immune response. Okay.
Yeah.
Questions? More questions? Okay, so I remind you. Well, do you want to say something? So I remind you to answer the test in the Sakai platform. For this week, you have to answer 3 tests. Lecture 12, Lecture 13, and Lecture 14. They are available already in the Sakai platform. And this week, we need to schedule a new class on Wednesday morning, the same as we did last week, okay? Because we need time to develop 2 lessons. So on Wednesday morning at 7 a.m., we will study the lecture 13 together with the other group, the same as we did last week. I have please,
Wednesday, not Thursday.
Tức là tuần này mình vẫn có hai cái lịch là thứ hai và thứ năm á em, là bài là theo lịch chính của Monday to, nhưng mà bởi vì là thầy muốn bổ sung thêm một buổi thì chúng ta sẽ học vào buổi thứ tư từ lúc 7 giờ, tại vì cô thấy lịch của mình là trống lịch vào ngày thứ tư á. Chưa hề. Vậy chúng ta sẽ bắt đầu từ 7 giờ cùng với lớp IDK2 hề.
Dạ.
Wednesday and Thursday both. I mean, you have class both days. Okay. You have class also on 9.
Tức là cái lịch thứ hai và thứ năm là chắc chắn là mình có rồi. Ở đây là thầy bổ sung cho chúng ta thêm một lịch. Và ngày thứ tư là chúng ta sẽ học bài 13 các bạn nghe.
Yeah.
Lesson 30.
Lesson 13 for Wednesday and lecture 14 for Thursday. Okay.
Rồi, các bạn lưu ý là nhớ hoàn thành mấy cái bài test ở trên Sakai nghe. Và có thể là trong...
Sorry. Thursday at 9. Sorry.
Và có thể là trong tuần này vào thứ bảy thì mình sẽ có bài kiểm tra giữa kỳ hay midterm. Thứ bảy.
What?
Midterm is
If we can, yes.
Dự kiến là chúng ta sẽ làm vào chiều thứ bảy các bạn, vì cô kiểm tra lịch của cái IDK 3 và 4 thì họ bận vào buổi sáng, có thể là chúng ta sẽ làm vào chiều thứ bảy. Chiều.
Never.
Phải các bạn học from the lecture 1 to lecture 9.
Bacteriology.
Yeah.
And self-learning topic 1, 2 and 3.
Rồi, vậy các bạn biết nội dung rồi đúng không? Từ bài số 1 đến bài số 9 và 3 cái nội dung tự học self-learning từ bài 1 đến bài 3 hả?
Questions? But we have to tell to the other group that we didn't tell them.
Yeah, I will send message to talk with them.
The midterm exam is always easy. Well, everything will be easy this year.
Rồi nếu mình có câu hỏi gì nữa không các bạn? Về nhà cố gắng học bài nghe.
Dạ.
Yeah.
Chào cô.
Rồi.
Questions about the class?
No.
Questions? No questions? Okay. So we finish the class. So goodbye and good luck. You need good luck.